Hi, I'm Dr. Mike Milligan. I'm on the board with the American Academy for Oral Systemic Health, and I have Dr. Michael Roizen with me. Michael, thanks so much for being with us.
Privilege, Mike.
You are the chairman of the Wellness Clinic at the Cleveland Clinic.
I'm the chair of the Wellness Institute and the chief wellness officer, yes.
Okay. And you've written the Real Age books, you've been on hundreds of TV shows, author internationally. Tell us a little bit about the Cleveland Clinic and the Wellness Institute here and the purpose and what that's all about in a nutshell.
The Cleveland Clinic started 91 years ago in 1921.
Okay.
It was a group practice. So what that means is that we didn't care who got paid as long as the patient got the optimal treatment.
Okay.
That was the founding principle, which was really radical in 1921,
Right.
and is still being copied, if you will, now. Because what we've done about 7 years ago is we organized by institutes. So, to give you an example, the Cardiovascular Institute is cardiology, cardiovascular surgery, thoracic surgery, cardiovascular medicine, has some rehabilitation for for cardiac patients in it. So rather than the patient having to figure out, do I go to a cardiologist or a cardiac surgeon, and if I go, should I get a stent or surgery? What the focus is, what can we do optimally for the patient?
Okay.
And the clinic has been rated in the top 4 hospitals in the world by U.S. News and World Report for whatever it is, 18 years in a row, and number 1 in cardiac care.
In the world?
In the world.
Wow.
For 18 years in a row.
Okay.
But the key thing is Dr. Cosgrove, our CEO, said if we're going to keep leading, we've got to do more than be great at patient care, education, research, which are the 3 legs of the classic 3-legged stool.
Right.
We've got to be, in fact, lead in wellness, because the only way the United States can lead can be a viable country, really, is to decrease the burden of chronic disease.
Absolutely.
And to do that, we have to focus on wellness, and so that's why the Wellness Institute was born, and that's why we focused on the areas we have.
Okay. And now, why have you partnered with the American Academy for Oral Systemic Health, the dental group? I know that when Oprah's finally got her ratings above Jerry Springer back when you marketed that you were on her show and you'll live longer if you drink more wine, have more sex, and floss your teeth. In other words, get your mouth healthy.
Right.
So why have you all partnered with the dental group, the American Academy for Oral Systemic Health?
Well, I think there are 2 key things that the dental group brings. One is that you're the army that can spread the word, because you see so many people.
Right.
And it's not just here in Cleveland or around, but it's worldwide or nationwide.
So we can disseminate the information.
Right. And the second thing is because inflammation, whether caused by periodontal disease or caused by something else, is a key component of, if you will, adverse health effects or keeping inflammation at bay, whether through periodontal care or through other, if you will, the food choices, etc. That is a key component of keeping healthy.
Right.
So you represent, whether it is through toxicity of mercury or whether it is through inflammation in gum disease or tooth loss, you represent a huge component of what people can do to stay healthy, to stay young, and to keep vibrant.
Okay, well, thank you. So you mentioned 4 main things that people could do environmentally, themselves, not necessarily their genetics, but 4 things people could do to live longer. What were those 4 things?
The 4 things that are the major things in chronic disease are to avoid tobacco,
right,
and secondhand smoke, and all tobacco products, chewing, etc. is included in that.
Right.
Make the correct food choices and portion size.
Right.
That means not only to stay thin from not overeating, but it also means to choose foods that do not have added sugars, that don't have added syrups, that don't have simple carbohydrates, that don't have saturated fat, and don't have trans fat. Be physically active.
Right.
And the 4th is manage stress. Now, as I went through the list, if you will, So flossing and see a dental professional is 11 on the list of most important things. So it's in one of those. If you combine the food into one, it's actually in the top 10 list of the most important things that everyone can do to stay healthy. And that's because periodontal disease causes inflammation in the rest of the body, not just in the gums.
Okay. And you talk about eating right and exercise and all. In the 2-hour presentation you just gave, it surprised me how really little you actually need to change in order to be healthy. There aren't a lot of changes, and it can still taste great, and it's not a lot of physical activity. Just do some, and of course they can get in touch with the Cleveland Clinic to learn more about that.
Right. Our Wellness Institute, we used our own employees as our learning ground of what works to change both individual and, if you will, employee health behavior, bent the curve down, and now we're sharing that with other companies. We have it as a commercial enterprise. You know, we don't want to make a lot of money, but we don't want to lose money on spreading this. So we teach that to other corporations and have programs that help do it. But you are exactly right. It is small changes that you make have big effects on your overall health and health costs and just your vibrancy and enjoyment of life.
So, well, thank you. So we've talked quite a bit about what the patients need to know. Now, what do dentists need to know or should know in order to be able to partner with the Cleveland Wellness Clinic and the American Academy for Oral Systemic Health in order to help their patients?
Well, I think it's pretty easy. They just log on to you guys and find out what they need to partner. But really, if I had my druthers, you, the dentist, would be the healthiest people you can possibly be. Your families would be there. You'd be role models, and you'd be the army spreading it, because you get all those patient contacts, and what you say actually really influences the way patients or people behave. So they care about their smile. Beauty is not just skin deep. Beauty is something that we choose our mates based on their beauty, and smile is a key component of it. Why do we choose our mates based on their smile? Well, why is oral health important? Well, you know the data on oral health and miscarriage, but it is we choose our mates based on their ability to carry our children. You, whether female or male, choose your mate based on that. And so a healthy smile means you've got healthy gums, which means that you're actually going to be a better partner for bringing kids into and having them live in the world.
Wonderful. Well, I think the Mayo brothers of the Mayo Clinic said...
Oh, don't do it. We're at the Cleveland Clinic.
Said a healthy mouth, with a healthy mouth you'll live 10 years longer. Years ago they said that. Now the Cleveland Clinic has taken that.
Well, we said it first.
Okay, Cleveland Clinic said it first. But so really then you'd like the dental profession to, you see them as an army out there to lead by example, get very healthy themselves, and bring that message to the public around the world in a way that will really disseminate and change the health and wellness of the world then.
Better said than I did. Perfect.
Okay, Dr. Roizen, thank you so much for being with us.
Thank you, Mike.
Okay.